Exactly. Had enough lectures that I had to attend. I had to know what we were talking about. Good morning. Welcome. Okay. Are we on? Okay. Well, everyone, ladies, 100% ladies, I'm excited to see you this morning, and thank you so much for coming. I'm really excited to talk to you about menopause. Although you know, I'm not in menopause, but I do treat a lot of women who are. I have a mother, I have an aunt who they are in menopause, and it's just something that does not get spoken about very often and does not get fully explained so that we as women have the education to know what's happening to our bodies and know what options we have to do something about it, because it doesn't have to be this scary, intimidating time when our health just bottoms out and we lose control. So again, thank you for coming this morning. Good morning. And when I give presentations, I love to be able to answer questions. So if anything comes up in the presentation and you want to ask right then, just raise your hand. Otherwise, I'll also give hopefully ample time for questions at the end. So this morning, I'm going to be talking about menopause, what's happening to my body, and what can I do about it. So really main points are, what is menopause? We kind of have some notion, but maybe not complete clarity. What changes are occurring to my hormones? Are hormones bad? What are bioidentical hormones, and how to feel great if you're even in perimenopause or menopause. So I like to say, why do I care about hormones? Every talk I give, whatever I'm talking about with health, I'm passionate about it because I've, for the most part, experienced it myself. So in terms of hormones, I messed my hormones up so badly in my 20s that I had to be on some hormone replacement. So it made me at a very early age understand the consequences of what disrupted hormones can do to a body. And I also see a ton of symptoms because of hormone imbalances, whether it's fully menopause or earlier perimenopause or dysmenorrhea or other hormone related things. So fatigue, anxiety, depression, low sex drive, anxiety, you name it, hormones really do run our bodies. So I'm excited to give you guys some more tools to understand. So as women, we deal with this on a monthly basis. We have several hormones, estrogen and progesterone, that are the most important in our bodies, specifically estrogen. So here we have our lovely day one. This is when we're having a menstrual bleed if we're premenopausal, so we're in menarche. Then we have ovulation, which that's when our estrogen really goes up, triggered by a little hormone called luteinizing hormone. Then estrogen comes down. This beige right here is progesterone towards the end of the cycle. It comes down and we start all over again. So for all of us, we're intimately aware of that, whether we know what the hormones are called or whatnot, or whether we just know. 7, we start to maybe feel a little differently. So just wanted to review that because we're going to be talking a decent bit about estrogen and progesterone and what's happening as we become perimenopausal, menopausal to our bodies and what we can do about it. So first off, what is menopause? We think, night sweats and hot flashes, right? Those are the two biggest symptoms that as women we're like, oh no, we know those are going to come someday. Maybe, mid-late 40s, you start to feel those symptoms, and it's kind of like, oh, this is beginning. What's going to happen next? Really, that's just the tip of the iceberg. just the tip. So, and I'll get more into symptoms, but really being menopausal is defined as the absence of a menstrual bleed for 1 year. So it's just a medical definition. There are hormones, no consequences that happen. Really, approaching menopause is a decline in estrogen. So if I go back here real quickly, we see that this blue here is estrogen. This curve just starts to get lower, 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 lower. So our menstrual cycles get affected. We start to lose the estrogen peak. With that, the key thing about that is we start to have effects in other hormones because estrogen is our master hormone. The amount of estrogen really affects testosterone and progesterone and insulin and all these other hormones because estrogen affects the receptors for those other hormones. So as estrogen goes down, testosterone activation goes down, libido goes down, progesterone activation goes down. So there's a lot of consequences of that estrogen decline. We also see, and this is sort of the biggest thing when I said hot flashes and night sweats are the tip of the iceberg, is we have an increased risk for a wide array of chronic diseases for no other reason but that our estrogen declines. So autoimmune syndromes, diabetes, hypothyroidism, memory issues, heart disease, cancer, osteoporosis, arthritis. That list can seem pretty daunting, and it really is. So that's partly why I'm here today, because I don't want these health issues to affect any of you or myself in the future any more so than is necessary. Symptoms of menopause, again, hot flashes and night sweats, the tip of the iceberg. It can be, bone fractures, weight gain, blood pressure, cholesterol, brain fog, hair loss, fluid retention. There's a lot. There's so much that some people consider it to be a medical illness in and of itself, and it's something that in our society where we have longer life expectancies, our menopausal years are becoming a large percentage of our lifespan for us as women. 40s, mid 40s, maybe late 40s, at the latest 50s, that's when it's all hitting. But our average life expectancy for women is, 70s, 80s. Some of us it's 90s, so that's a long period of our life where there's a lot that could be happening that is not talked about and is not well managed. Right now, how it is managed is with antihypertensive medication. So for that blood pressure that is getting elevated because of that estrogen decline, you're getting recommended blood pressure medications, or you're getting recommended cholesterol medications, or diabetic medications, antidepressants, allergy meds, being medicated for something that is a physiological consequence of a hormonal decline. Now, of course, could there be other underlying health issues that could lead to or exacerbate some of these? Menopause is by no means the only cause, but it's definitely a sort of physiological inevitability to some degree. Oh, by the way. Hormones and aging. We're not really talking about as a society how important hormones are. And really, we are as old as our hormones. So the aging process, yes, it's, cell death. It's something that just inevitably happens, but the rate at which it happens is in large part dependent on our hormones. So hormone depletion is a major contributor to aging. And this is, again, physiology. Progesterone for women starts to decline at age 30. That's me. I'm looking at this saying, okay, I'm at my peak of my progesterone now. It's going to be going downhill. Estradiol, which is our strongest, our most metabolically active estrogen when we are menarchal, when we're having a menstrual period, that starts to disappear around age 50. So that's the main estrogen that as it comes down is affecting us in menopause. Testosterone for women declines up to 50% from what it was when we were 20. So really, aging is hormonal decline. Those two are, peanut butter and jelly. So another statistic, every day 3,500 women enter into menopause in the US. So there's a lot of us, and we deserve attention, and we deserve to know what's happening to our bodies so we can make decisions about what we're going to do so that we're not pressured into, cholesterol medications or antihypertensives or things that maybe don't fit our paradigm. Or maybe they do, and that's fine too, but I want to give you options. So next thing to talk about is, are hormones bad? So you've all been around, long enough to probably have heard that hormones cause cancer, right? Who's heard that hormones cause cancer, right? And so because of that, there's a taboo, there's a faux pas, we're not going to touch hormones are bad, we obviously don't want to get cancer. I think, what's the statistic in the next 10, 15 years, over 50% of people are going to have cancer at some point in their lifetime. So that's really on the rise. So there's a lot of fear around that. But the reality is, and this is the case in most studies, the golden information is all in the details. So hormones can cause cancer, but it depends on the form they're in, how they're dosed, and in what, well, form and dose for the most part. So I'm going to get into that in a moment. In 2002, the Women's Health Initiative study was undergone, there you go, and they looked at the effect of synthetic hormones on women. But at the time, it was hormone replacement therapy, so using synthetics. And they actually had to end that study early because of some really bad findings of increased stroke, increased thromboembolism, a lot of health risks that made the study unethical to even continue. So at that time, synthetic hormones were thought of to be bad, but it wasn't emphasized that it was synthetic. It was just hormones are bad. So as a consequence, hormone replacement therapy really went down. And so what happened with that, let me just go to the next one, is that women stopped being treated for hormone replacement therapy in their perimenopause or menopausal years. So a lot of the increased risk for stroke, heart disease, all that sort of crept back up. Now, there's a key differentiator between synthetics and bioidenticals. So I'm going to get into exactly what bioidenticals are. But like I said, the key thing to know for hormones to mitigate the risk of cancer is the dose and the form. So by dose, I mean, is it 5 milligrams a day, 10 milligrams a day? Are you doing it in a rhythmic way where you're changing the dose throughout the cycle? That's dosing, as well as what hormones you're giving. Unopposed estrogen has some major risk factors because estrogen is the hormone that is proliferative. It causes breast tissue growth. It causes the growth of the lining of our endometrium. It's a proliferative hormone. Progesterone is a hormone that is designed to balance the proliferative effects of estrogen. So if you're giving unopposed estrogen, right there, that's a bit of a risk factor. You need to balance it with progesterone. And in a natural menstrual cycle, we don't just make estrogen, we make estrogen and then we make progesterone. So we need to mimic what we're doing. And the form is also key. In the Women's Health Initiative study in 2002, they were doing oral conjugated equine estrogen. Any oral form of hormone, how we process it is that our liver gets the first pass metabolism. So a large percentage of it is essentially cleared out of our bodies, and the form the hormone is in changes depending on what tissue it's delivered to in our bodies. So the oral form is going to be higher risk, and what hormones you're pairing it with are going to mitigate some of the risk factor as well. So really, what I'm trying to emphasize is that menopause is natural. It happens. It's normal physiology, but there are health consequences associated with it that we can treat from various different perspectives. Again, I talked about the pharmaceutical medication side. Now I'm talking a little bit more about the hormonal side, which I believe is a healthier option because it's essentially mimicking what our bodies naturally did when we were in that better state of health. So what are bioidentical hormones? Who's heard of bioidentical hormones? Yeah, a lot. Ever since that study, one of the good things that came about is that women started becoming more curious. Okay, well, if synthetics are causing a higher risk for cancer, what about bioidenticals? So in the last 15 years, there's been such a proliferation of compounding pharmacies, different options, so that those are more available to us. But there's still not a lot of doctors that are savvy and prescribing those for women because of that fear that hormones cause cancer. And for better or for worse, in the medical field, doctors are afraid of liability. So if hormones cause cancer, they don't want to go there, whether or not that's even accurate. And so who's left affected? Women. So here, bioidenticals, completely different. So these are Well, bioidentical is a little bit of a misnomer in that it's not 100% bioidentical, but it's plant-derived in a biological structure that is most similar to our own hormones. So for Andrew in the back, the term is used to describe plant hormones synthesized to have the molecular structure of a hormone, of a human hormone. And they can be used to decrease those health risks associated with menopause and increase well-being and vitality. So not being monitored and tested, they need to be monitored and tested to make sure that they're appropriate and safe. So even within, bioidenticals, it's still really important to know how much you're giving, how much that's translating in terms of an increase in the hormone in the body. So we still need to know and test what we're doing. It's not that there's zero risk with bioidenticals, but compared to synthetics, completely different ballpark. So if you're approaching perimenopause being your cycles are starting to get a little bit longer between bleed, or your bleeds are starting to get a little bit longer. Essentially, your menstrual cycles are becoming a little bit irregular. What that is that's a sign of your estrogen starting to come down. So with that, you may be having some symptoms of hormonal imbalance already. Breast tenderness, depressed mood, anxiety, fatigue, poor concentration, weight gain. Those are the beginning signs. So those are symptoms to say, hey, your hormones are changing, and this is the best time for you to take some action to mitigate those health risks associated with the rate of decline that your hormones are taking. So what can you do? Essentially, if you are perimenopausal or if you're even already in menopause, there's still a lot that can be done, even if you've already started to have those symptoms, had those symptoms for a long time, to mitigate those health risks. So there's the basics. The basics, basically, keep your body moving, build muscle. So for all of you that work out next door, congratulations, you are doing a fantastic job, because putting muscle on your frame helps in so many ways. It decreases your risk for osteoporosis, which decline in estrogen greatly increases your risk. So you're helping your body there. You are also helping your body sensitize itself to insulin. Insulin is another hormone that gets affected as estrogen goes down, so helping with your blood sugar. And you're improving your testosterone. So those are three of the major benefits of having a strong, healthy body that become even more important in menopausal years. Second thing is nutrition. Anti-inflammatory diet. This is good for the vast majority of things, but in menopause as well. Limiting grains, dairy, and sugar, emphasizing those colorful fruits, veggies, nuts, seeds, and quality proteins, because in menopause, as well as many other challenging times, as that risk for chronic disease rears its head, it's more important to have the foundations of health in a solid place, so that that risk for cardiovascular disease, depression, anxiety, all of that, there aren't other things that are contributing to it in addition to the hormonal decline. Support your body's ability to produce hormones. Now, like I say here, that's limited by the fact that we can't say, hey, produce more when our organ function has declined. So this segues me into, in menopause, our ovarian production of hormone declines. And what happens is it shifts a little bit. Who's familiar with what the adrenal glands are? Yeah? So our adrenal glands, they produce our stress hormone, cortisol. We're familiar with that one, right? Fight or flight. But in menopause, what happens is that those glands, we have two of them right above our kidneys, they have an extra burden. They're now our major production of testosterone, of DHEA. So hormones that used to be produced also in part in the ovaries. So it's all that much more important to support your adrenal function at that time. So we can use herbs to support adrenal function, to support the clearance of estrogen, to support making estrogens. There's a lot that can be done with herbs, but in my opinion, you're not going to be able to mitigate those health risks 100% with the use of herbs, vitamins, minerals, nutrition alone, because the physiological decline of estrogen is just going to put you in that higher risk category. Now, what I run into in my practice is that there's a bit of a philosophy, of a bit of a dogma about natural health, which I completely love and respect. And that is that menopause is natural. So why would I do anything to treat a state of being that is natural? You know, we as women experience that decline. We have since the beginning of our species. It's just our biology. So why do I need to do something about that? So my response to that is you don't. You don't necessarily have to treat menopause, because menopause is not a disease. It is a physiological state of being based off of how we are programmed from birth to death. Now, what I'm concerned about is the health risks that come, again, with that decline in estrogen. So what I think is important is that you all understand what's happening to your bodies, and that you can talk with your doctor, whether that's me or someone else. I just want to give you the information to know that there are options, and whether the pharmaceutical way of treatment, nutritional herb, hormone, there are things you can do. I want you to make the best choice for you, given your lifestyle, given your ideology. So the last thing here is keep your liver healthy. Your liver is a very important organ as it relates to hormones, because it clears out your hormones. So in hormones, we have the production, we make hormones, then we have the conversion from one form to the other. In menopause, the conversion that's really important is estrone, which is our one estrogen, estradiol, which is our second one, and estriol. We start to make less of estradiol, and it converts more into estrone. So we have less of the stronger metabolically active estrogen that naturally happens in menopause. And then we clear the hormones out. Once they've been active, our liver conjugates them and we flush them out. So keeping your liver healthy with avoiding caffeine, sugar, alcohol, excess stress, all those sort of things are definitely going to help with the symptoms of menopause too, and just overall health. So above and beyond the basics, we have bioidentical hormone replacement therapy. So with that, for women, there are primarily two hormones. So we have estrogen and progesterone. So estrogen is our key hormone. Estrogen accelerates growth and metabolism. It burns fat. It builds bones. It's our major hormone. It's pretty much the number one reason why our lifespan as women is longer than men. We have more estrogen. So all the pros and cons that come along with it, that's our major one. Now, progesterone relaxes smooth muscle, normalizes blood clotting, assists thyroid function, and protects from tissue overgrowth. So particularly that last point, protecting from tissue overgrowth, is really key, because we talked about estrogen is proliferative. Progesterone balances out that proliferative effect, because with supplementing with hormones, we don't want excess growth of breast tissue, excess growth of your endometrium. More growth, exponential growth, that is what a cancer-like process is. So one of the ways we mitigate that is by making sure that we're doing both hormones in appropriate ratios. Now, it's also important to supplement with testosterone, but only if needed. Testosterone is the third primary sex hormone. Now for us women, like I mentioned, testosterone production shifts to our adrenal glands. So there, what becomes really important is stress management, good sleep-wake cycles, healthy emotional outlets, everything that helps us keep our stress at a healthy level, because otherwise what I see very often is in women, and this also affects men, when we're more stressed, whether menopausal or not, our body's going to make cortisol, our stress hormone, to the exclusion of testosterone and even estrogen and progesterone, because just from a biological perspective, we're primed for survival. So cortisol is more important than those other sex hormones under that state of fight or flight. So we can also reverse engineer that and say, we need to make sure we're not in that fight or flight to give our bodies the best chance to make our natural hormones. And in menopause, that is very key for testosterone. You should not necessarily need to supplement with testosterone in menopause unless there are other lifestyle factors that are interfering with your production. Progesterone and estrogen, however, those are the ones that are primarily going to decline. Okay, last slide here, take-home points. So, number one, you do not have to suffer. Menopause does not have to be this scary time where you're worried about having a heart attack, where you're worried about, being, in a crowd and getting a hot flash and sweating. It doesn't have to be this uncomfortable time. You can also have amazing sex. So something I haven't talked about yet is vaginal dryness. Pain with intercourse. I see those every day in my practice, and women that are distraught because their partner still is active and it hurts, or they can't perform, or there's no desire, and those are just consequences of hormonal decline. So when we are able to bring your hormones back up to a healthy level, that's probably the number one thing that my female patients are saying that they're incredibly happy about, and really helps the health of their relationship. Because again, menopause is late 40s, mid 50s, so you have how many 30, 40 years left to live? So that's a great one. You can also stay fit. Weight gain is a major issue for menopausal women, and some women are just going to say, what? That's just my lot in life. This is happening. This is my decline. There's nothing I can do about it. And there goes the cycle of, poor eating habits, poor emotional health, because they feel helpless. Really, you can stay fit, building that muscle. You can still build that muscle even into your menopausal years. The more you build, the more it feeds back and helps your hormones. So staying fit is really, really important for your mental emotional health, for, just so many reasons. Probably one of the biggest ones is going to be osteoporosis. I work with people 60s, 70s, 80s, and I want to set them up for health so that they're not afraid of falling when they're 85. Because the statistics are, if you have a fall and you fracture, your health goes right like that, and that's the quickest way to decline. So in our 40s, 50s, that's when we're setting ourselves up for the health that we're going to reap 20, 30 years down the line. So my point, you can protect your health into your 80s and 90s. And really, I guess, biggest takeaway from this morning is menopause doesn't need to scare you when you know what's coming and you know what you can do about it. So my question is for you, what do you want to create for yourself, and what do you want to do? So with that, I am happy to answer any questions you may have. I could talk about this for hours and hours and hours and go into more detail, but ladies, questions?
Just for the 2002 study you were talking about that correlated synthetic hormones to cancer.
Mm-hmm.
So was that an FDA study?
The Women's Health Initiative, correlated synthetic hormones to cancer. I don't know if it was FDA. I don't know who was the organization behind that, but if you want more information on it, Google the 2002 Women's Health Initiative hormone replacement study. Essentially, it was trying to see, is supplementing estrogen safe for women? And they had to, again, cut it early because they realized with the forms that they were doing, it was not safe. But with studies, you can't say, therefore, all hormone replacement is not safe. You have to say that specific form, synthetics, in that dose is not safe. So since then, there's been a lot more empirical data gathered on bioidenticals. The FDA has yet to come out with a full statement saying, we certify bioidenticals as 100% risk-free. We've not gotten that, but what we have is hundreds of thousands of women that have had bioidentical hormones without the increased risk that we've seen from the synthetics.
So I guess what I'm asking is there current clinical studies in the FDA regarding bioidenticals?
That is a question that I'm not sure on. Yeah, I would hope so.
Yeah.
But I'm not sure.
Okay.
Yeah.
Sorry, my ignorance. Excuse my.
No problem.
The pills that
yes.
we used to have during all our life.
So your birth control pills?
Yes.
Yes.
Are those synthetic hormones?
Yes.
Right,
Birth control pills are synthetic.
All right. So what about if myself, sorry, I'm using hormones because I have an illness
Yeah.
that without it I will have other consequences.
Uh-huh.
How can I balance these treatments to prepare myself for menopause when
Sure.
I'm right now using synthetic hormones?
So your question is, just for those listening, so you're on oral birth control pills.
No, I'm using how do you call it?
Patch,
No, it's
cream,
inside of my.
troche, suppositories,
No, it's
a vaginal, we'll say a vaginal delivery of hormone.
IUD.
IUD, okay,
Anything
yes.
like that one.
Yes. Yes. So you're on an IUD, and so how's that going to affect you into menopause?
Exactly. I cannot take it out because otherwise I will have a lot of problems. I have a clothed
Sure.
situation,
Yep.
anemia, whatever.
So there's a lot to your question.
Right.
To answer it directly is, to answer it indirectly, the IUD is covering up a problem. It's
Right.
not treating the problem.
Exactly.
So your IUD can either be copper, in which case it's irritant based, but more likely if you're using it for the hormones, it's going to be progesterone based. Synthetic progesterone based. So there are a lot of risks that come with that. Synthetic progesterones do have a greater risk profile than bioidentical hormones. So bioidentical progesterone. So what I would say to you, more than likely, again, I can't diagnose or treat in this setting, is have your hormones fully assessed, figure out why you're having the health issues that you are, because the synthetic progesterone in the IUD is covering up an imbalance or a problem. It's not treating it. So that is going to make it slightly into menopause, because you're going to have had a greater risk factor for a lot of the health issues that you will have in menopause from having been on synthetic progesterone. So again, and how I treat is trying to figure out the why. So I have a lot of women that have heavy bleeding, painful bleeding, uterine fibroids, the absence of a bleed when they should be having a bleed. There's a lot of imbalance, and that can go back to stress. That can go back to hormone deficiencies. That can go back to nutrient deficiencies, digestive issues, other hormones that are affecting your sex hormones, genetics. There's a lot to figure out of underlying causes. Right now, you're able to manage that by, with the IUD. And that's kind of the analogy would be going back to the slide where I said antihypertensives, anti-anxieties, GERD medication, all that. That's how it's being treated, is symptom management. And there's not necessarily anything wrong with that, but it's not addressing the underlying reason. It's keeping you on that synthetic. Does that answer the question?
Yeah, it makes a lot of sense. So,
okay.
Summarizing, even though I'm treating an illness I have right now, and
Yep.
probably it's good for me at the moment, for the future, for my menopause process, which will come eventually.
Right, so is
I have already
sure,
the
is
symptoms.
being on the IUD good for the menopause? It is not going to help you, because menopause, the decline of progesterone comes primarily from the decrease in estrogen that affects the progesterone receptors.
Right.
So you're essentially, say you stay on the IUD, going to be keeping that static, low-dose synthetic progesterone, and estrogen's still going to go, meow. So you're going to, it's not going to be a long-term solution, let's put it that way, and it's not going to help mitigate the health effects and the potential symptoms of menopause.
Right. Okay, thank you.
Mm-hmm.
Thank you so much.
Any other questions? Yeah, Laura.
Okay, so just so I understand, menopause is natural, estrogen goes down.
Yeah.
But because we're living longer lives and we want to live healthier, longer lives,
Mm-hmm.
vibrant, longer lives, we want to naturally add estrogen and progesterone
Mm-hmm.
back into our body and kind of mimic the life before
Mm-hmm.
menopause,
Mm-hmm.
so that we're healthier and stronger in more of those second half of our life years.
Mm-hmm.
So we're basically sort of fooling our body that no, we're not aging.
Yep.
We're not quite done yet.
Yep.
So how long would we continue taking the bioidentical
Sure.
estrogen and progesterone combo?
So yeah, so question is, using estrogen and progesterone to sort of mimic your pre-menopausal years, and how long would you be doing that? As long as you want to. So right now, I can't remember if it's the FDA who said this, but they have found no benefit after the age of 65. However, that is not looking at your well-being and how you feel. So it's coming from the standpoint of, from a disease standpoint, they don't have any data to conclusively say that it's beneficial to keep going after age 65. But I have plenty of women that are over 65 feel very good. They still have anxiety. They still have depression. They've had a fall. They have osteoporosis. So at that point, our options are you can use bioidentical hormones because they mitigate all of those symptoms and all those risk factors, or we can use, nutrition and herbs to the degree to which we can, or we can use pharmaceuticals. So there's sort of three options, or you live with how you feel. So again, I don't tell my patients what to do. I say, hey, these are the options. What makes the most sense to you? To me, when I'm in that place, I'm going to use hormones. Because for me, that's the most natural option that's going to get me the best results. I don't want to be on 10 medications and then medications for the medications, and then having liver issues because I'm processing out those medications. And then, the herb and the nutrition component, yes, that, like I said, whether you're on bioidenticals or not, that's always the foundation. That's where to start, because that's only going to help. But in those menopausal years, we're limited by the fact that estrogen is just going to be low. So, I have women that, have been on it, not through me since I haven't been practicing 20 years, but that have been on bioidenticals for 20 years. And that's helped with so many health issues. But that's a lot more rare.
It would be low enough that you wouldn't have periods?
Very good question. So I didn't get into that because the specifics of dosing could be another hour in and of itself, but suffice to say there are options for how you dose. You can dose statically, which will not induce a bleed. So statically is basically, let me go back here to juxtapose. So statically would be saying you're getting the same amount of estrogen and progesterone every day. So imagine a flat line for estrogen and progesterone. Now that what we could also do most of the time would be you're going to do estrogen, 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 progesterone. That would be another option, which is sort of still static but not rhythmic. Another option, third option, is rhythmic, where we're doing estrogen and progesterone. So your dosing is different depending on where you are in that 28-day cycle. So you can put yourself in a state of hormonal arrest, similar to birth control pills. So, birth control pills that unfortunately the vast majority of women in our society are putting themselves in a state of hormonal arrest to not get pregnant. There are a lot of health issues with that are also not being addressed. So more than likely my next talk on hormones is going to be about birth control pills and what are better options. But for right now, well, primarily because those are synthetic. So all the risk factors we've been talking about for synthetic hormones for menopause, vast majority of women in their actual menarchal years are on birth control pills, and they're synthetic, and that's a whole other scary realm. But yeah, so rhythmic is the other option, where rhythmic you would potentially be inducing a bleed, but it's going to depend on, the vast majority of women will, but it's not necessarily going to be as big of a bleed as when you were ovulating, because this is going to be different. Luteinizing hormone here, it's not going to trigger ovulation, even though you have a little bit of what's called a withdrawal bleed. So there are a lot of health benefits to the rhythmic side of hormones, because achieving these peaks does a lot more than just cause a bleed. It sends signals throughout our body. Primarily, progesterone signals apoptosis, programmed cell death. Think of it like cancer cleaner-upper cells that are just circulating in your body trying to mitigate cancer when we get that progesterone peak. So there are a lot of reasons why a normal, healthy menstrual cycle needs to be in full swing as compared to static dosing. But again, the one downside, if we were to do rhythmic, is you would have the return of some bleed. Any other questions? Yes?
What, oh, go ahead.
Nope, no, go ahead. I pointed you first.
What
Yeah.
is the ideal like age or timing for women to come in and actually figure out this is the right time for them?
Sure, so what's the ideal time to essentially get your hormones evaluated and figure out where you're at? Definitely in the perimenopausal time. So as soon as you start to notice your bleed is a little longer, or you're no longer 28 days, you're maybe 32, 36, or you're 19, 20 days, you're noticing those imbalances in your cycle, which relate to your hormone levels. Figuring it out before you're frankly menopausal would be ideal. So in the perimenopausal time, if we can get you on hormones that keep your hormones in a healthy menarchal realm, that's going to mitigate the health risks of menopause to a larger degree.
So what happens, for instance, I've already gone my whole year
Yep.
without it, so what can I expect now?
Now, I would say, in my opinion, from a pro-con health risk standpoint, I would still recommend bioidentical hormones from that health risk standpoint. Now, there's obviously individual cases, and we have to talk about that on a one-on-one to see what's going on with your health, genetics, family history, and so on. But for the most part, there are the pros, in my opinion, for most women, again, can't say specifically, outweigh the cons, even if you're already menopausal.
And do you do it by taking blood samples or actually checking?
There's different ways to evaluate. So there's pros and cons to different methods of treatment, analysis. So blood, saliva, and urine are the three biggest ways to measure. It'll kind of depend on what your health profile is and what your risks are. I will either start out with urinary testing because that allows me to see the active hormones as well as the metabolites. So going back to liver health, if your liver is not very healthy, not from a disease standpoint, but from a detoxification standpoint, it would not be very prudent for me to give you bioidenticals because you're not going to be clearing them out properly. You're going to have more symptoms. Now, I want to know your liver is working well. So if I have any concerns about that, I'm ordering them in the urinary way, so essentially urine. I can also do blood. For the most part, in follow-ups, to see where your levels are, I'm checking blood. Now there's a caveat to that, is that progesterone is going to be harder to assess in the blood. Saliva is going to be the best, but it's the easiest and most cost-effective to be testing, over time via blood samples. Yeah.
I was just going to ask a similar question about what's the process from start, not start to finish, but how do you start this whole process?
Sure. So I start all my new patients with a new patient visit where we're looking at all of your chief concerns, whether it's, menopause or whatever the symptoms are. And then we're talking about health history, family history, head to toe, everything that's going on, because as we said, even in relation to menopause, there's a lot. Insomnia, dry eyes, anxiety. I want to know the full symptom profile. And based off of that, ordering testing that's going to be most appropriate to what you're experiencing. And or, if you are already menopausal, I pretty much know where your hormones are. We can start without testing. But if you're not yet, if you're prepared to bleed 3 months ago, but not since then, I want to know where you're at to know what dose is appropriate to start you at. So we're either doing testing then or starting and then testing follow-up in 3 months, making sure your dose is appropriate. Okay, thank you so much for coming, ladies. I'd be more than happy to answer any other questions you may have. Thank you for your attention. Oh, Barbara.
Does insurance cover your services?
Very good question. No, I am not contracted by insurance, which means that insurance will not cover my fees directly. And that's primarily because insurance covers what is medical standard of care. Insurance will cover birth control pills. But if you want to be more proactive with your health and you want to understand more what's going on, why, more options, more time, that's why I work for my patients. I don't work for insurance companies. There is an option if you do have a PPO insurance, you can submit for reimbursement, but that's going to depend on your insurance plan. So that's not something that we know, but that you can definitely ask your insurance company.
Can you use your family savings?
Absolutely. Flexible spending, health savings, 100%. That's your health money pre-tax. I say all my patients should be using that because so, great. Well, thank you. Dave, do you have any words?
Yeah, ladies, just thank you all for coming. If you guys have any questions for me in terms of the process further, let me know. If you're interested today, we are offering $50 off the initial consultation if you sign up today. Feel free to come talk to me, answer any questions you might have.
Yep, we'll be here.
Thanks so much.
Thanks.
And your location and office hours?
We are on the Mesa in Santa Barbara. We're there Monday, Tuesday, Thursday, Friday. We have morning hours 2 days a week. We have late night hours 2 days a week, so depending on your schedule. And we can also do follow-ups via telemedicine should you be traveling in and out. We want to make it definitely easy for you.
Thank you.
Of course, Barbara, thank you. Oh.
Yes, great.
Shh.